Welcome back to the Morning Blend. It is the most common cancer for men after skin cancer, but treatment is often successful. We're talking about prostate cancer. Guys, don't wait to get yours checked. I know it's not the most fun thing, but it's gonna save your life. Here with the importance of early detection is Dr. David Ludlow. He's with urology specialists of Nevada. Great having you.
Hey, thanks for having me back.
So prostate cancer, it's one of those screenings, it's like you don't really want to bring it up because you're not really looking forward to the whole thing. But you have to get checked.
Unfortunately, that's still part of screening.
Yeah.
Hopefully, by the time you're 50, we'll come up with something new.
But, I'm hoping. So, explain what prostate cancer is. We'll get down to the
first
basics.
of all, prostate's only in males.
Yeah.
It's a little gland that sits underneath the bladder, and unfortunately, as you mentioned, most common cause of cancer in men, and the second most common cause of death from cancer in men. So that's why it gets its own awareness month. So it's very important that we educate people about it.
But the fortunate thing is if you can detect it early, good rate of success.
Yes, exactly. And people are always asking if there's symptoms, and they're saying, well, I don't have symptoms, I need to get checked. But in actuality, there's not really any symptoms, only in rare advanced disease. So it's important you get screened. And screening is a blood test called PSA. And then, unfortunately, as you mentioned, the dreaded prostate exam. Oh, you're a natural, looks good.
Yeah.
Once a year, 50s and 60s. So a lot of people ask, when do I need to start doing screening? And that's well. And there are certain populations that are a little bit more at risk that may want to start early, specifically if you have a family history of prostate cancer.
Okay.
And it's also more common in African-American men.
Wow. Okay. Now, you're screening it for 50 and 60. I'm assuming that's when the majority of it happens, but it can happen earlier as well.
In rare cases. But yeah, in general, I think if most people start at age 50, they're going to be just fine.
All right. So let's talk. We've talked about the test, the PSA screening being one of them. That's a blood test.
Correct.
And the other one being the rubber glove test.
Physical exam, correct.
The symptoms, what are some of the symptoms? What would you see?
Usually there's no symptoms.
Wow.
You know, and that's what, you know, a lot of people are in denial that they could have cancer because they don't have any urinary symptoms. Usually symptoms are from enlarged prostate, which isn't cancer.
Yeah, of course.
Yeah.
So, all right, let's talk about treatment options. We were actually just talking while we were in the break. Treatment options used to be a lot more invasive.
Exactly.
And there's a new option coming.
Yeah, a lot of people have relatives that maybe had treatment years ago and have a lot of residual side effects.
Yeah.
A lot of new technology. First off, one thing to mention is a lot of times if it doesn't look like aggressive disease, you don't even have to treat it. We can watch it.
Really?
And then as far as treatments, the two staples, which Urology Specialists of Nevada definitely offer and are very good at and have gotten much better at as far as the technology, is robotic prostatectomy. And that's a way to remove the prostate, but you don't have as much blood loss and pain.
Wow.
It's a type of laparoscopic surgery. And then radiation. We have a radiation oncologist, Dr. Becker, who does the newest Calypso technology. And again, less side effects with treatment. But I'm happy to announce we have even new technology coming. A lot of people are asking, is there even a less invasive way? And people that have done research has heard of this technology called HIFU, which is high intensity frequency ultrasound.
Okay.
It's been around for a few years, but only recently got FDA approved in America for
It takes some
treatment.
time for the FDA to flip the switch on those, yeah.
And this technology is amazing, and we've had patients asking about it, and nobody in Nevada, Arizona, Utah has it, but we're getting it. Urology Specialists Nevada is partnering with a couple other urologists in town to bring it here.
Wow.
And essentially, it's an outpatient procedure.
No kidding.
No incisions, no, you know, staying in the hospital.
Wow. What's the typical like right now? If I were to go in for a prostate cancer procedure, how long am I in the hospital? What am I looking at?
Well, that used to be a lot worse. With robotic surgery, it's gotten much better. Usually you're overnight in the hospital, maybe 2 days, but then you have to keep a catheter in for about a week, which is still much better than it used to be. But with HIFU, it's through a camera, so no incisions are made. Camera through the swimsuit area. And it's something that urologists are very familiar with because we use a camera to treat enlarged prostate with a lot of different frequencies such as laser and different things that ablate the tissue.
Yeah.
But the problem is those just ablate the superficial benign enlarged prostate tissue. It doesn't go deep where the cancer sits.
Yeah.
But with the frequency, it's able to penetrate deeper to where the cancer is. So it's the same thing that urologists are used to, going in with the camera and treating the prostate, but we're able to get deeper and actually treat the prostate cancer.
No kidding.
Yep.
So how long are you looking at for, as far as recovery for the procedure? How long are we keeping that pesky catheter in?
Usually, well, it's an outpatient procedure, usually done in a surgery center. And often we'll just keep a catheter overnight just to let things kind of recover.
Wow.
So much better. And so far the data shows, as far as from a cancer standpoint, it's comparable to the other, radiation and surgery.
Technology is great.
So we're really excited. Come see me or any of my partners. We'll tell you about it. We got 3 locations, best urologists in town. We're happy to talk more about it.
It's a great avenue. Thank you so much.
Hey, thank you so much for having me.
Men, that is great news. If you have any questions, get them answered about prostate cancer. Urology specialists in Nevada, they have 3 Valley locations. And if you want more information on them, you can visit the website or call the number on your screen. They're also on Facebook and Twitter. That has incredible technology.